George Goodnow, and I'm back with Seth Ginsberg at the Bio 2012 International Convention here in Boston, Massachusetts. And Seth is the co-founder and president of the Global Healthy Living Foundation. And Seth, will you tell us a bit about GHLF?
Sure. So the Global Healthy Living Foundation, we're a nonprofit organization, patient advocacy group. We're committed to helping people with chronic diseases feel better, educating them about things they can do to manage their condition better, as well as represent these groups of people in helping them overcome the barriers to care that unfortunately exist today. And a part of Global Healthy Living Foundation are specific communities for people with various chronic illnesses. One of the larger groups called Creaky Joints, which is our arthritis community with more than 60,000 registered members, many of whom people living with forms of arthritis like rheumatoid arthritis rely on biologics and these innovative therapies to stay healthy, to stay active, to live the life they want to lead, which is why we're so excited to be here and a part of Bio, because we know that this is the central hub of innovation. This is where these medicines come from. And it's our job to represent the patients and to talk about the meaning that these drugs have to us, and then hopefully ensure access to as many people as possible, because having technology which breeds these types of innovations doesn't necessarily mean we can get them. So that's the central core, the central reason that advocacy is so important to us and why we're so excited to be here.
Fantastic. Thank you for that. Now, I've seen you speak a few times, and your passion is evident. And part of that is I've seen you explain how you came about to co-found GHLF and Creaky Joints. Can you say a few words about that?
Sure. We, for 13 years now, have been convening organizations and groups of people with chronic illnesses, and it all got started way back in the day when I was diagnosed with a form of arthritis called spondyloarthropathy. I was 13 years old, and when I was 18 I went away to college here in Boston, to Babson College, and it was literally the second week of school, 3 o'clock in the morning. I was feeling vulnerable, I was really alone, and I wanted to share strength and experience with other people. And that's how Creaky Joints got started 13 years ago. So whereas it came from a dorm room bunk bed, today we are a very robust and a very active organization working on behalf of the entire global arthritis community, which is fun.
That's fantastic. Thank you. Now, this isn't your first Bio International Convention. How many of you attended?
So this is not my first rodeo. This is actually my second. And had a chance to walk the show floor today, yesterday, and I'm just amazed and blown away at how much innovation, global innovation, there is out here, and what it means to bring all these people, 25,000 people, I think.
Well, we're actually, I think, we're over 15,000.
Okay.
25 is a very optimistic number. I would like to see that.
I double counted the people from France and Maryland, but to have 15,000 people and 25,000 meetings, I think was the number I just caught on the board outside, means that something's happening. A lot of things are happening. I think big things are happening is the slogan that Bio has, and right on. You know, this is what we need. We need what's going on in here so that when we're diagnosed with a systemic autoimmune condition or a debilitating neurological disorder, our doctor says, don't worry, there's something for that. And this is where it comes from. So we're really excited about that.
Fantastic.
And I did want to add one other thing, though, because at GHLF, we're really excited to have a chance to convene many organizations to talk about the importance of advocacy and the ability to use social media, right? Here we are on a webcast, and this internet is sticking around. And we did want to just give a plug to our friends and the program we're producing this fall, every fall, the second annual E-Advocacy Summit, which is just eadvocacy.org or hashtag EADV, E-A-D-V, which will be the largest and most substantial gathering of organizations in the country who will be convened at the Museum in Washington, D.C. to talk about social media for policy and how all of our collective organizations can come together and leverage the power of the internet to make our footprint felt and to make our voices heard within the various state and federal policy arenas that matter so much to us when it comes to getting access to care. So just to tie it all back here to bio, the reason that we're excited for e-advocacy, the reason that we're excited to be here is because we know that there is so much work that needs to be done behind the scenes, and there are so many ways that we could help each other as a group when we nurture collaborative advocacy. So we're just thrilled to be here.
Thank you for the plug on that, and it's actually sponsored by our mutual friend Amy O'Connor at Lilly, and it's a fantastic program. And
we'd be remiss if we didn't say that you should follow LilyPad at LilyPad, which
absolutely.
is one of the coolest manufacturer-sponsored tweeting handles out there, and really interesting stuff with the developments and things like PDUFA. What the layman would consider the minutia of policy, but what the advocacy community and the healthcare community knows are so critical, these issues like the Prescription Drug User Fee Act that enables us to get access to medicines sooner. Things like that, these folks are working so hard to do on all of our behalves, and it's just a privilege to be a part of it.
Absolutely, thank you. I think we have to wrap this up.
We do?
Thank you very much, Seth.
We do.
Oh, we do. And thank you, Seth. This is Seth Ginsberg with the Global Healthy Living Foundation, and I'm George Goodnow with Bio. Thank you.
It's good to be here.